What's new with what we know from healing of the brain now is that the brain heals in 10 to 14 days. We know the effects of injury to the brain through either a concussion or a traumatic brain injury heals. And we know it heals in basically 2 weeks. The issue becomes is what you do in that 2-week period of time. At one time we thought going into a dark room, not having any stimulation, letting your brain sort of recover on its own was the treatment of choice. We now know that that is clearly not the case. Very quickly after you are injured in a concussion, you need to start a specific exercise program. And it's not an exercise program out running or jogging or return to sport. It's a very specific program that integrates your vision with your balance, with auditory input, hearing at times. So we need to know that we introduce that at the appropriate time. The new rules say 2 to 3 days you should start a supervised program. And that's really the key for this, is you need to get to somebody who understands the relationship of allowing the brain to heal over those 2 weeks and then starting the proper exercise early on. At HDPT, we are on the cutting edge of that. We've understood for a long time that the intervention that we initially start you at really is the treatment that prevents sort of post-concussive syndrome. And really, after that 2-week period of time, 80 to 90% of people do extremely well. But the key part is getting to somebody that understands where that intervention needs to take place. And at HDPT, we can assist you with that. Yes, we know that if you do nothing in that 2-week period, even if your brain heals, you are very susceptible to what we call the post-concussive syndrome. Post-concussive syndrome, and again, if you look at our website, post-concussive syndrome is a whole basket of symptoms. Some people have few, to some people have full-blown post-concussive syndrome, to sleeping disorders, memory problems, light sensitivity, hearing sensitivity, significant anxiety, basically not feeling like they're doing anything, that they're basically unplugged. We know that proper stimulation early prevents that. People who do develop post-concussive syndrome can have problems for years. There's a very good study that just came out of Ohio, and they looked at basically 7,000 people that had documented concussives 10 years prior, before we really understood the effects of having lingering concussive, post-concussive syndromes. All those people in every category scored very poorly. They had ADL, activities of daily living, they had problems taking care of themselves. They had very big memory problems. They had significant cognitive problems, basically problems with executive function, basically functioning in school, functioning in a job. They had persistent post-concussive syndromes. So we know that not treated properly, those symptoms carry over not only for a period of time, say in your sport or in your job after a concussion. We now know that when we test them, they've had problems for years and years and years, just nobody recognized. It started with poor intervention early in the concussive process. The most important part is that a traumatic brain injury is a concussion, and a concussion is a traumatic brain injury. You can have it as simply as a slip and fall in the house. You don't have to lose consciousness. Sport is, sort of the obvious one we hear a lot about these days, or a car accident. And generally speaking, there's some very good evaluative tools. They call it neurocognitive tools, where they use a questionnaire on you, and you get identified either through your physician, through an emergency room, urgent care, athletic trainer, physical therapist, that you sustain a concussion. And if that occurs, you can call us directly at HDPT. We are in every insurance company, including Medicare, and you can direct referral. Colorado is a direct referral state, and you can call us and come in for a free consultation where we'll explain exactly what we do to you. But again, in this process, the earlier the better.